I'm going to have the next speaker coming in, Dr. Duong.
My name is Dr. John Duong, and I wrote 5 books and international speakers. My true focus is more for like creating a system and a habits creator so that people can heal chronic pain and chronic disease. So what's the purpose? People live a better quality life. So there's 3 parts to this. This is, right now I only have to do part 1. So how can, the title is what? True Healthcare System, Healing Through the Flow of Energies in the Body Structure for Cellular Regeneration. So how does the body heal itself? Through diet and exercise, right? But I will go deep into every part of it. Exercise is the part 1. So I will be back for part 2. Okay? So, true healthcare system. Do we have a true healthcare system? So what we need to do is that we need to ask questions to know the truth, because the truth will set us free. In the United States alone, how much do we spend? We spend over $2 trillion on a healthcare system. But in reality, do we have a healthcare system or a sick care? What is this sick care system good for? What is this model for? Positive. Is this good? The model is for acute emergency crisis. It saves your life. So that's acute model. Can you use the acute model for chronic conditions? No. That's why people are very sick. They're not getting better because we're using the wrong model to fix the problem. So now it's another question. Keep asking questions, right? What can we use acute models for like a chronic condition, a heart, cancers, diabetes, pain, and chronic pain, right? Can we use that? Are people getting better? So now another question. How can we fix the chronic pain and disease? So what do we have to do? How do we fix the chronic conditions? Supporting the body so the body can heal itself. That's why exosomes, stem cells, as we age, our stem cells is diminished. So we need some support, supporting the body so the body can heal. Ozone, right? What's the purpose of ozone? Killing germs, bacteria, virus, parasite in your system. So what? So the body has a better chance to heal. This is my personal story, leading me to do what I love to do today. So create a system, because we want to improve the healthcare, the true healthcare system, right? So I love to do what I do. What's the purpose? As a result, people live happy, live a better quality life, enjoying life. My personal story is my dad, 18 years ago. He has an open heart surgery. This really opens my mind. He has diabetes, he has hypertension, high blood sugars, high blood pressures, and high cholesterol. He is carrying a bag of medications. And yet the doctor said, hey, you have to have open heart surgery. You have 2 choices. Choice number 1, have a heart attack and then open heart surgery, or open heart surgery. So he has an open heart surgery. And then it really wakes me up. In this society, are we getting healthier or getting sicker? I know the answers, getting sicker. So what do we have to do? I have to step outside and look for patterns. What is the disease pattern? How can we find out the pattern, fix the pattern? So first, I don't have the problem. My kids, my families, and now I will share this information to the world. So now people can have a better quality life, a true healthcare system. How does the body heal itself? This is how I determine it. 2, diet and exercise. What's the other part? People do the diet and exercise, yet they're not healing. What's missing? They cannot replace new cells. I call the 3 major ones is going to be the bugs. It's going to the bugs like the parasite, the yeast, the bacteria, the viral. Those are the bugs in your system that will lingering it from healing, because it will diminish our energy. It's all about energy. Energy, frequency, and vibration. It would diminish us from healing. What's the second one? It's the poison. I call it poison. It's the pesticides, the plastic, the chemical, the lead, the mercury. I classify as poison. What's the third one? Emotion. Emotion is the big killer. You can heal with your emotion, your thoughts. Okay? Or you can hurt yourself with the thoughts. Okay? So emotion is a big package. So it's the package of things that get the patients better. So how does the body heal itself? Cellular regenerations. The body can, what's the body needs? Is the body heal itself by breaking down old cell, right? Apoptosis. The body, it will break down, and then also it needs to make new cells. For example, how long is the red blood cells in our system? 120 days. How about the livers? How long is the liver cell can regenerate? 8 weeks. The gut lining, every three days. And the nervous system. Nervous system, we can regenerate in 8 months. So that's the important roles of the diet and exercise. Today, we're going to particularly do more with the exercise. What's the diet? What does the diet do? Give you the raw material to make new cell. And also the diet is what? It gives you energies, right? And energies, because glucose converts into ATP. Energies, that's part of diet. And then while you exercise, what's the purpose of exercise? Anyone knows? It's the flow of energy, right? What's the purpose of energy? Generate energies, generate frequency. I will demonstrate to a lot of people here is the energies, frequency, and vibrations. What's the purpose? For cellular regeneration. And we also need to know what's the drainage that drain our system to make new cell. The bugs, the poison in motion. Conclusion, the body will need diet and exercise to heal itself, but it can also drain faster than it can create the new cells. That's why the body stay at a chronic condition. That's not healing the way it is. So I always pray for wisdom. I can help to explain a very complicated problem and make it simple. Remember, it's the flow of energies in the structures for what? What's the purpose of diet and exercise? Cellular regenerations. In here, what do we see? We see skeletals, the nervous system, and the organs, right? Anything that affects the spine, does that affect your organs? Anything affect the organs can affect the spine. And I'll show you the research on that. Okay? So this is more than just the skeletal, nervous system, and organs. What is it? It's the flow of energy to the organs so it can heal. So in this system, what we're looking at is more than just the spine. When you exercise, it's more than just the spine. What are you exercising to generate the energies in the skeletal system? The musculature system, when you exercise the muscle. What does the muscle do? When you exercise the muscle, generate voltage, energies. So now you can use it to heal. What's the nervous system? Okay, lymphatic, right? We know that if there's lymphatic is not draining the way it should be, does that lead into diseases? We already know about it. Okay, the integumentary system, the hair, skin, right? Circulatory system, respiratory system, digestive system, endocrine system, urinary system, reproductive system. So it's just more than just a spine. So take care of your spine, exercise your spine, make sure it is a routine. You have to do what? In order for your body to heal, you have to have a habit. How do you have a habit? If you value it. And then I want to share with you so that you can see the value in terms of taking care of this treasure. What is the treasure? Is yourself. Okay, so we have a lot of orthopedic doctors a lot of pain specialists here. What are the two major causes of neck and back pain? The two major ones. I ask the patients all this. What are the two major causes of the problem? Pressure and inflammations. P for pressure, I for inflammation. What is that? Pressure and inflammation. This is the condition, right? There's a lot of diagnosis in the MRI and X-ray. What are some of the diagnoses? Degenerative disc. What caused degenerative disc? What caused bulging disc? What caused herniated disc? What caused thinning of the disc? What caused it?
I wouldn't be surprised if bugs have something to do with it.
It does. That's why there's the drainage. Definitely. Because my talk is going to be on exercise today. That's why if Dr. AJ is going to invite me back, then I will talk more about the diet and then also the bugs, the poison. Yes. So degenerative disc, what are the causes of that? It's the pressure. If you have a bad posture, what does it lead into? Pressure. Pressure on where? In the disc. Degenerative disc, bulging disc, right? Herniated disc. Thinning of the disc. How about if it's pressure on the bone? Does the bone get weaker or it's getting stronger? Get weaker. What does the body want to do? Build up more bones. Osteophyte, right? Okay? Why is it pain related? Bulging disc, herniated disc, right? Irritate the nerve. Put pressure on the nerve. It's pressure. Okay? If it's pressure on the bone, what happened? The body doesn't want you to have fracture, right? What does it want to do? Make it stronger. By what? Building up more bones. So it's the osteophyte. When there's osteophyte under foraminal, it's called foraminal stenosis. If this is on the canal stenosis, right? Why do we have pain? Irritate the nerve. What are the two causes of neck and back pain? P for pressure, I for inflammation. That I is part of the infection we're talking about. Very good. Research and quotes. Dr. Rogers Berry, Nobel Prize recipient in brain research. What he said? 90% of stimulation and nutrition to the brain is generated by the movement of the spine. Do you understand that? 90% of nutrition and stimulation to the brain is generated by Dr. Duong's two pumps. We will talk about Dr. Duong's two pumps. 90% of nutrition and stimulation to the brain is generated by the movement of the spine. So that's the second. Is in the physiology of joints. Kanbaji say that every inch that your head is moving forward, anterior head syndrome, what happened to your head? When you move like this, when you bend your neck like this, 1 inch moving forward, increase what? 10 pounds, increasing the pressure. So what does it lead to? Muscle strain, herniation. What is that? Pressure. Pressure. What's the second one? Mayo Clinic, November 3rd, 2000. Emphasized on the anterior, same thing, anterior wave pairing, cause the long-term muscle strain, disc herniation, arthritis, and irritate the nerve, pinch nerve. Pressure. Dr. Bui, neurosurgeon, Nobel Prize recipient, his work suggests that the loss of cervical curve, if you lost the cervical curve, it can stretch on the spinal cord by 5 to 7 cm, potential leading to diseases, right? Anything affecting the spine can affect your organs. Anything affecting the organs can affect the spine. That's why we have the term visceral somato reflex and somato visceral reflex. Friedman on JAMA in 1957 discussed about the deviation in the body center caused by poor posture lead to various health problems, including the digestional issue, hemorrhoids, varicose vein, osteoporosis, deformity in the hip, on the brain. So it's all about what? It's about the pressure. So what do we have to do? We have to fix the pressure. How? How can we fix the pressure? Sitting up straight. Sometimes we slouch, it's okay. We just need to consciously reduce the pressure. There's more research, right? Remember, what's When we exercise, what's the most important? Is the flow of energy. When you exercise, what do you generate? Energies, frequency, vibrations. What do you want to do? You want to flow it into what? Your organs, so we can do what? Cellular regeneration. It's energy, cellular regenerations. I'm going to go quickly over this. Chiropractic research and autonomic nervous system. So it,
4 minutes.
okay. The spine can affect the autonomic nervous system, especially in the C1, the cervical, and on the cervical spine, because you will see that again. That's because that's the most autonomic nervous system exit right there. Spine and digestive health. We know that the spine can affect the digestion. Spinal cord injury and organ dysfunction. Here's the research. So kyphosis and the lung, right? It's common sense, right? Is it common sense? Yeah. Can you breathe better? Okay? This is how you can breathe better. Scoliosis and cardiovascular health. Scoliosis can affect the cardiovascular health. Visual somatic reflex, right? This is the research. Anything affected the organs can affect the spine. Stress on the spine can have an impact on the organs. Do we have enough research to indicate that the spine is very important to your health? So tell me the cause of the problem and have a system. You have to have a system and continuously doing it, reminding yourself, so now your body has the best chance to heal. So what are the two causes of neck and back pain? The two major causes? Pressure. So today is going to be on pressure, okay? So, and have a system. How do you fix it? How do you increase the pressure? Dr. Duong 2 pumps. What's Dr. Duong's 2 pumps? This is increasing the pressure on the low back, reducing the pressure. All the pressure go to your butt, okay? All your weight go to your butt. And then what? This next one, let's look in the ceiling. Lumbosacral pump and occipital pump, okay? So have a system. How many of this you need to do in a day? How many times do you do like this? A lot, right? So 60 times, but with the thoughts, with a purpose. You have to create a habit to reduce the pressure to allow what? The better flow of energies. So now the body can heal itself because the energies that you use to heal itself. So that's why I said, what habits? Dr. Duong's habit, 2 pumps. How many of this you do in a day? 60. Just move around. The purpose is that every time that you do it, what do you have to do? Reduce the pressure on the spine. You see the spine? Why C1 is the most important joint in the whole body? C1, the upper cervical, because all the nerve. Sympathetic nervous system, parasympathetic nervous system. Dr. Duong 2 pumps is where? It's more on the lumbosacral pump, on the parasympathetic, and upper there, parasympathetic nervous system. And the flow of energy, what's the purpose of flow of energy? To create the energies to heals the body. So what's the purpose of like PEMF, right? They say like the shock wave. So now you can use the energy from outside sources, so now you can go into your body to heal. We heal both based on voltage, energies. The sun, can we use the energy from the sun to heal? There's energy, there's frequency, vibrations on the sun so that you can use it to heal. That's why infrared, like the doctors will talk about photo modulation. It's about the infrared. You can use that light to heal. On the injured area, stimulates so you can heal. How about the earth? Do we have energy in the earth? Negative electrons, right? You can use that energy, but you have to have what? The flow of energy, so now it can go to your organs and heal. Is the flow of energy. Is the flow going to be good? No. This flow is better, okay? The therapite, this is, it has a lot of energy, 500,000 volts of energies in that. And Sumana energy, environmental. There's also energies that we can use to do what? To heal the body. Exercise, the lumbocecal pump, occipital pump to reduce what? Reduce the pressure. We're increasing pressure. Most of the people have what? A lot of anterior scalene tightness. Barely touch it, you have a lot of pain because of what? Pressure onto the muscles. Okay, so what's the purpose? How about a lot of people have brain, right? The most important thing is the brain, the energy to the brain. 90% stimulation and nutrition to the brain is generated by the what? Movement of spine. Movement. Get the oxygen, get the flow. The flow of energy is to heal what? The brain. Exercise, the movement is important, but the thought is more important. The feeling good. When you do the pump, what do you have to feel for? Reduce the pressure. So now the flow of energy to go what? To the brain. The most important is the brain. Fix the brain and you fix a lot of health issues. Feeling good is the secret. You have to feel good, positive. So feeling to reduce the pressure and the flow of energies in the body to heal. This is the most effective way of doing the pumps. So in conclusion, how do you fix the chronic pain? Supporting the body so the body can heal itself. What does the body need to make new cell? Needs nutrition. Okay? And the white building blocks for the new cell. What's the second? Exercise. Generate the energies, generate voltage. More importantly, the flow of energies so now the body can heal itself. What's the third? Stop this drainage. This is major. A lot of people cannot heal because of that. And then stop the drainage of the cellular regeneration is very, very crucial. That's why we have to, the most important thing is, just want to lead, is the parasite. The fungal Dr. Harris is talking about. But the parasite, the fungal is the cover layer. Deal with the parasite. Okay, so that's my presentation, and thank you very much.
That was great. That was great. Thank you so much.
Thanks.